talk about the standard or definition of occupations. And I think the best way to explain this is to tell you the story of a nurse by the name of Ann Kay and how her general workplace standard of occupation in her disability policy doomed her disability claim. Now, you've heard me say many times that one of the most important definitions in a disability insurance policy is the definition of occupation. Why is that? Well, to get your disability benefits, you have to prove that you're unable to perform generally the material and substantial duties of your occupation. And how your policy defines the terms occupation and what your occupation was at the time you became disabled can make all the difference as to whether or not you get the disability benefits you deserve. Now, Kay worked as an operating room nurse for 13 years, and she developed some spinal problems. And as a result, she changed her occupation. And she was a clinical specialist and was paid on a per diem basis. She underwent low back surgery and she returned to work to her employer, Synron. But Synron emerged with another company called the Candela Corporation, and they hired her as a full-time clinical specialist and a senior medical device trainer. Now, unfortunately for her, her surgery was not completely successful and her low back pain returned, and that caused limited range of motion of her spine. Her treating doctor took her out of work and said, look, I'm going to do a set of x-rays. And when they did the x-rays, they noticed that she had lumbar degeneration above her old fusion. And on physical examination, she had mild radiculopathy as well as chronic L5S1 radiculopathy. That means she had leg pain radiating down her leg. And she also had severe cervical degenerative changes and narrowing in her spine without nerve impingement. So she filed a short-term disability claim and she was paid those benefits. But as she became eligible for long-term disability benefits, Hartford terminated her benefits, noting that she had to prove, based on the terms of her policy, that she couldn't perform the essential duties of her occupation as generally recognized in the workplace. Now, Hartford, of course, was looking for a reason to deny her claim, and they had a vocational evaluator look at her occupational history and the description of her occupational duties. And they decided that her occupation required her travel to customer locations, move devices, and that required her to sit and stand for hours, push and pull up to 20 pounds, lift and carry up to 20 pounds. So they did this vocational analysis and then gave it to their paper review doctor to look at her medical records. And of course, what happened? The paper review doctor said she could perform those duties. Now, she appealed, saying, wait a second, that's not the correct occupation, nor these duties that I actually have. They're not what you described. In fact, I have to lift more than your VE analyzed my occupation to be. And she, of course, argued that as a result of her diagnosis, she couldn't meet the strength levels of her occupation. So on appeal, Hartford gave the file back to their vocational evaluator, and the VE concluded that her occupation was a combination of a training representative and a general duty nurse, and that the occupation's essential duties involved administering treatment consistent with nursing techniques and preparing medical equipment. Now, the other part of her job required her to conduct individual and group training programs for employees of industrial, commercial, or governmental clients of this company, and that the physical demands were in the range of light to medium with occasional lifting, carrying, pushing, or pulling up to 50 pounds. Hartford then had a second physician review her medical records, and of course, that physician disagreed with her treating physician about her restrictions and limitations. And as a result, Hartford upheld the denial, and away we go to federal court. So the court starts out this analysis by looking at the definition of disability. And the policy said that a person was disabled if they were prevented from performing one or more of the essential duties of their occupation. And the term your occupation was not subjective, and it didn't consider her specific duties. Rather, there was an objective definition of occupation, and that was as recognized in the general workplace. In other words, she had to prove by a preponderance of the evidence that her medical diagnosis prevented her from performing an essential duty of her occupation as recognized in the general workplace, not as how she performed it. Now, the problem was that Kay did not explain why her medical condition prevented him from performing her occupation. And she failed to challenge Hartford's vocational conclusions. And that was really the key that led to the court denying her claim, because the judge wanted to see that she had addressed what in fact her occupation was, what her occupational duties were, and that there was hard medical evidence that she was unable to perform those essential duties. So as a result, the court was left with no choice but to accept Hartford's paper reviewing doctors' opinions about her restrictions and limitations, and why her diagnosis didn't prevent her from performing at the medium level. As a result, the court upheld the claims denial. Now, lessons to be learned here, obviously, is you need to understand what the definition of disability is in your policy. If the carrier has a vocational evaluation, you need to have your own vocational evaluator take apart the carrier's analysis and come up with an opinion as to, in fact, what your occupation is and what your level of physical functioning is required in that particular occupation. You should have either an IME or a functional capacity evaluation to measure your strength, and then have your physician endorse those findings. That's, I think, the best way to rebut a misclassification of a person's occupation and a carrier's conclusion that your restrictions and limitations are something other than what your treating physician has had to say.